But I do disagree with
anything constructive.
Yes, your opinion about circumcisions, I highly disagree with. Yeah,
I honestly wish the weather.
What's your opinion on circumcisions?
Circumcisions.
Yeah.
Okay.
He's against circumcision.
Sure, we can.
I
prefer to call it male genital mutilation. but-
Honestly, I get where you're coming
Literally.
from. Because when they do that to women, it's called female genital mutilation.
Well,
so I
women
would
don't
do
get
the same.
circumcisions, but I think
They do in other countries.
Ultimately,
Okay, yeah. So why are you in favor of circumcision?
Circumcisions help with lowering risk of penile cancer, help lowering risk of STDs.
No, it doesn't.
Yes, no, it does.
No, it
help
doesn't.
lowering risk.
Maybe in America.
It doesn't.
STDs. No, it does. It does.
Maybe in
It does.
America.
Well,
Yeah, in America, yes, it does.
Yeah,
Why?
we're like the only country that does
if
it.
you don't mind,
Yeah.
can we get your opinion? Then your opinion, that would be great.
versus
So,
no.
so it is. It's slightly decreased. It slightly decreases the risk of penile cancer, certain STIs, and UTIs in men. Also, it's a little bit like. I mean, I'm just speaking from men I know. Like as they got older and they thought like, oh, if I wouldn't have been circumcised, I feel like a lot of women would have looked and been like, what the heck is that? Like a giant
lot of guys are
elephant
girls
trunk, you know?
Yeah, oh my
Yeah.
God, that's just the way it looks though. But like
Girls don't like
health-wise,
that.
Can you either fix your posture or tell your
Sorry.
mic?
Yeah,
Yeah.
health-wise, that is accurate
no,
information.
it's not because
Well,
It is,
hold
but
on.
go ahead.
Well, so let me so there were two claims there. There's the cancer claim, the STD claim.
And UTI.
The STD
And
claim
UTI.
no.
would it UTI? No, not really. But I mean, well, maybe. But
Yes.
the STD one potentially even makes sense intuitively. However, the cancer one seems dubious.
It's a very decreased risk, but it is. You can look it up. Also, the UTI
Okay, we
is
will.
because
Look it up.
the people don't do proper hygiene and they don't retract
So
the
let's
foreskin.
actually talk
they
about that for a
stink.
minute. So it is extremely uncommon for a man to get a UTI. Let's also talk about
Yeah.
it is extremely
It is.
uncommon for a man to get a UTI.
Yeah.
It's uncommon. And if a man has a UTI, there's something else wrong. It is not just an infection.
Like a
It is
herpes
more
virus.
than that.
Okay.
When a man has a UTI, there's something else wrong because the urethra is longer, and therefore when they pee, and even, so let's talk about men and women. When women get UTIs, we get them more frequently because our urethra is shorter. We also have a vagina. So there's, yeast. There's a big difference between men and women getting UTIs.
No, so the issue is you're probably referring to circumcised men. When I'm saying, I know their length of their urethra. Well, my point is when a male is uncircumcised, bacteria gets under the foreskin. So it gets caught in there and it travels upward because people don't know the proper way and they don't retract the
Well,
foreskin.
then you teach the
That's
kid how to properly clean the penis.
well, this is I'm just telling him why it is beneficial to get
and
a
it takes off
circumcision.
so many nerve endings, and it's just not proper. Like in other countries, they don't do the circumcision.
I don't really much care about other countries,
And they're
but I do care
fine.
about
They're
the
not
US.
dying of cancer and AIDS.
Okay.
I have a question though. So, for example,
I mean,
if
I don't
we were
even-
hold on, stop. If we were to compare, let's say there was a procedure that removed women's breasts. Well, I guess you can't remove their breasts at birth. But if there was a procedure that hold on. No. Let's say there was a procedure stop. Let's say there's a procedure after women went through puberty that removed their breasts. Would there be evidence of decreased risk of breast cancer in those women if we remove their breasts?
Yes.
Well, would that justify the removal of women's breasts to prevent cancer?
For a just in case.
I guess it depends on how important you find breasts. I had 2 breast reductions, so they really aren't important to me.
There are plenty of women that do remove their breasts.
You realize
if they have-
circumcision is done on a mass scale here in the United States, other countries, a few other countries.
Sure.
So it's not clear to me because there is, and perhaps this is just a correlation, it's not clear to me if the decreased risk of cancer is enough pretext to warrant mutilating a child's genitals.
Sure,
Yeah.
I understand what you're saying. I don't think the cancer part is that massive because, like I said, it's a very small reduction. But the infection is a major benefit of getting a circumcision because, like I said, bacteria does get stuck under the foreskin. That's
so is there just like, because I
fact.
believe in Europe there's not a bunch of circumcision. Is there just like rampant STI, like UTIs for men in Europe?
I imagine the education is probably way better than it is here in the U.S. because, again, circumcision is so baseline here. But also, I've heard people say in the show that later on you should leave it up to the male, when he's, a teenager or whatever. If he wants to get that done, he can make the decision. Well, that recovery is going to be a heck of a lot different than when you're an infant and you don't reproduce those memories, you don't remember those things. So it's it's a larger surface area as well. At that point,
your
when
wife or whoever's dating you should like just accept your penis the way it is and like
right,
your
anyways,
circumcised or uncircumcised dick. But like most uncircumcised dicks are like. They're not mutilated. They're not mutilated.
If we stick to the medical discussion of it, so let me just I'll just, there could be some debate over whether, what you're saying is actually true, if there is a decreased risk of cancer, if, with the UTIs thing. I'll just cede it and say, sure, fine. However, there's also cases where men do get circumcised and it gets botched.
Sure. Mm-hmm.
So there is while it might have some corresponding positive medical benefits of circumcision, there's also corresponding negative outcomes to circumcision. There can be nerve damage, there can be damage to the glands, there's cases where the entire penis has to be removed. There's been cases of that, and then that's absolutely catastrophic. So, and then, there's also the consideration of, well, does inflicting, could this be actually mentally damaging, psychologically, young babies?
Do you think so normally you don't reproduce memories, or you can't?
So do you think if you, for a period of the first year of a child's life, if the parents were just beating the child, it wouldn't have any impact on the child at all? They just forget it?
Well, I think that would have, I don't know that they would remember it, but it depends if they would cause legitimate medical issues.
I don't know.
Slammed their head or shook their baby, then of course that causes specific medical and neurological conditions. But I'm not sure.
Wouldn't there be a stress response though that the child would have that would give it some sort of trauma?
Sure, I don't think a one-time circumcision would do that.
But if it is a very painful procedure though, if it is a very painful procedure,
and you also they
kid.
give things like little anesthetics in babies. We can use glucose water, just like little sugar can be used as an anesthetic in a baby, and so they give them that. And did you ever notice that after now I have 2 boys, both have had circumcisions. Sorry, boys. But either way, did you ever notice that after the procedure, within an hour or 2, they don't cry anymore? There's no pain. They don't. It's just it. They don't. You don't even when you're cleansing the area. There's no response.
I'm actually totally indifferent on this. I don't really have an opinion on this, but I was actually really enjoying watching you two go back and forth. It seems like you're chomping at the bit to say something over here.
Yeah. I want to kind of piggyback off of what Brian was saying. Just because they don't feel it and we don't know that they feel it, is it at that point still okay? Like he's saying, you could punch your kid in the head and then...
They do feel it. I think you're talking about you're talking about 2 different types of traumas. You can go ahead.
I just want to point out the argument that you're using is the same argument that pro-abortionists use, where they say, well, you can kill the kid because the kid can't remember. So it's the same argument where you say you can
Oh my
chop
God.
the kid's head.
That's
very
true.
No,
Is that right? Would you agree?
What?
No.
It's the same argument. The kid can't remember, so we can chop its dick off, but the kid can't remember, so we can abort
they
it.
wouldn't have a life. They wouldn't have a life if you aborted a child. They wouldn't
but you're
even
still
have
doing
the
something to
option.
them without their consent. That's what I'm saying.
Yeah. Okay, go ahead.
Also, another thing to consider is that man's going to grow up. That boy is going to grow up. It is statistics that men with foreskin it's more sensitive. It's more enjoyable.
Good point.
So,
yes.
you're making a decision for your sons about their future sexual lives.
Yeah.
They have no say in.
I had a friend as a kid who
true.
got circumcised when he was a little baby and they screwed it up and his penis never grew. Maybe that was in
Oh my God.
I've never heard that. That's crazy.
So he had a micro penis?
And he's sitting out here.
He had a micro penis?
So I just Googled this from... Hold on. Guys, stop. I just Googled this from Boston Children's Hospital. The reported surgical complication rate, while low, is between 2 to 3%. So you know, you can debate whether that's significant, but I mean, if there's hundreds of thousands of, I don't know how many per year, whatever, but I mean, that ends up being a lot of men who there's botched circumcision.
Sure. I also think, I think a lot of men are circumcised, and to your point, I really don't think that they're complaining of their issues being pleasured. So it might be more, but if you never have, it's like a virgin marrying another virgin on their wedding, like, and only having sex on their wedding night. They don't know what else is out there, so that is the best they're going to have. So if somebody is circumcised and has sexual relations, that is just what they think is normal, you know? And so I don't think that's really a great argument.
That kind of sucks, though. I'd rather be able to have
again,
body
you're
autonomy,
taking
and if I
away-
could have more pleasure, I'd take it.
Right, but the thing is you're taking away an opportunity that they don't even know about.
Well, if they want to take on that opportunity later in life, it's going to be a real hell of a problem, because it's going to be a really bad recovery. It's going to be much more painful. They're definitely going to have memories about it.
I actually had another friend.
You have a lot of friends.
I had another friend, once again, just asking for a friend. No, I had another friend who got the procedure done at 14 years old, but that was only because this guy's in a different boat. But his penis grew to the point where it stretched it, so he had to get it cut off.
Yeah.
So opposite problems.
Yeah,
Right.
opposite
I do-
problem.
this
And
sounds
then
so
my friend
fake.
Liam was born with a
No.
Liam was born with a condition called penis minutus,
It's inverted. Let's be real.
with an innie. No.
There's always
We're
going
proud
to
of my
be
TikTok.
risks.
Pretty much.
Of course, I don't know, and I haven't looked into this, but the risks of getting a circumcision later on in life, I don't know what that is. If that's a higher
Yeah.
risk for something like that.
He was a
Imagine
14-year-old that couldn't do anything with it for 3 months.
But I mean, is what, like, look, there's a bunch of countries where they don't do this procedure,
Yeah.
and is there just like catastrophic, like this
No.
catastrophe for men upon no, they're fine. They
Yeah.
didn't get circumcised. They're fine.
Like I said, I think you have to. It's a lot of different components. It's not like in medical care you can just say, oh well, in other countries they don't have circumcisions and it's all fine. So if we did the same thing, it would all be fine. There's a lot that we would have to change in terms of our education. The amount of education nurses have to do with patients and families is incredible. There's barely enough time to get it done, and then the patients don't even follow that anyway half the time. So it just depends. But yeah, if the education was better.
Hold on. But so you're saying that because wouldn't it be like a 5 minutes of instruction? So it's worth chopping off boys' foreskin without their informed consent because it would be it'd be labor for the nurses to instruct them or for the parents to Google?
There's no labor issue. There's a compliance issue. You can tell a patient to take a pill twice a day and they still don't do it. It just happens that way.
Well, don't we instruct like
I want one.
Oh yeah, can I have one more?
Go ahead.
You know what? Can I have one?
Put that for
All right.
everybody, bro.
Hold on.
No, I'm good.
Can I have one more? Stay awake.
But anyways,
That'll
yeah.
keep you
But I
awake.
see your point.
Oh wait.
Either way.
Can
That's
I
just my
add
one little
something?
thing.
So I have 3 boys, and they actually, 2 of them were born with something called a hypospadias.
Yes.
And they actually needed to use the foreskin to properly fix their penises so that it would look
Could you
like an
describe what that
average-
is, though?
It's when the urethral meatus,
Is-
the opening for where the urine comes out, is too low, so it points downward.
Yeah. And so they actually like form the hole at the tip whenever they do the surgery. And I had to wait till they were 6 months old. Like one was 6 months, one was like a year. And there definitely was a lot more recovery than my middle son, who was newborn and got it done. But the reason why I chose it personally was more of a societal thing, and because I personally had an experience with a man who his foreskin was adhered to his penis.
I think people are
And-
forgetting that does happen.
Yeah, and it was
I don't think
so
people even
painful
know that
for
that
him. He
happens.
couldn't do
Because
anything.
Yes.
what's that
Foreskin
from?
can be adhered to the tip of the penis, meaning they can't retract it back.
It's extremely painful.
Why
So it
why
can
does
be
that
very-
happen? Like what causes it?
Just congenital
Improper care,
just
too.
yeah.
Not proper care.
That too. but-
That too. I mean, yeah, like I said, you have to. It's a specific way of having to, like, hygienic practices, but
Yeah, if you're consistently